Sheila here too, or no?
Yeah, she's
Come on, Sheila, go ahead. Thanks for all of you for being here on such short notice. As many of you know, that the state certainly has been working around the clock to prepare and aggressively respond to the COVID-19 novel coronavirus. While we still don't have a diagnosed case in Montana, I do anticipate that we will have a case soon. We've been monitoring the situation as it rapidly evolves and as it's rapidly evolved over the past few weeks. To prepare, about a week ago, we announced a task force on coronavirus to ensure that the state's doing everything possible to aggressively respond. It's headed by Adjutant General Matt Quinn. Task force is ensuring that state, local, public health, and the federal government are working to keep Montanans informed and with both accurate and up-to-date information. Today, I'm furthering our efforts to prepare by issuing an executive order declaring a state of emergency in Montana. By doing so, I will have the ability to further direct a coordinated response to COVID-19 and to mobilize all resources necessary and to take additional steps as may be necessary. Emergency order puts our state on the highest alert, recognizing though that now is still the time to continue to plan, not panic. Just like we do with any challenging situation when it hits our communities, we stick together, we make sure that we mitigate the impact, that we have an appropriate response, and do all that we can to slow the spread when it comes. Also wanted to announce that we have several new resources for Montanans to receive reliable information about COVID-19. We've launched an informational phone line at 1-888-333-0461. That's 1-888-333-0461 for Montanans to call and receive reliable information about their concerns. At this time, the phone line will allow Montanans to leave a voicemail with their question or concern, hear back from a state official as quickly as possible. Montanans can also email covid19info@mt.gov. As far as the hours of that, right now it's both the telephones and the email is during working hours, but the emergency declaration, to the extent that and the demand is there, then we'll also look at further staffing it beyond the workday hours. Task Force has also launched a website to keep the public apprised of actions taken. It's at covid19.mt.gov. So no dashes or anything like that, covid19.mt.gov. Site also links to the DPHHS website, which includes updated and timely health information. Again, I'd like to stress, as I did about a week ago now, that the most important thing Montanans can do right now is help protect themselves, their families, and their communities. That can be as simple as following everyday steps to prevent respiratory illnesses. And it's not just for yourself, it's also in the event, as you come in contact with other individuals. Also, certainly stay at home if you have cold or flu-like symptoms, and call ahead before visiting your doctor if you're experiencing those symptoms. This will help the healthcare provider's office take steps to keep other people from potentially getting exposed. Task forces will continue to meet regularly to closely monitor the situation, to develop new and additional steps now and in the future to support our fellow Montanans, and guess would underscore, well, we have the formalized task force. This is something that's not just happening during those meetings and events, but on a regular basis. Montana has always been a place where we look out for our friends, our family, and our neighbors, and it'll continue to be that way as we respond to COVID-19. Any questions?
We've had some pretty big events in the state canceled, like Big Sky Tournament and other things, but high school sports is still going on. I mean, do you ever foresee a situation where you as governor
Are
would
we
step
able to
in?
ask questions through the line?
Hold on just a sec. Somebody's asking a question. There will be an opportunity, though.
You know, like we saw in Seattle, governor they ordered school shut down in that area. Like, do you foresee ever having that sort of role in like?
Yeah, this is a really dynamic situation, and it really, really is. I mean, today, and you saw the announcement that they're switching at the university system, and we worked closely with the Commissioner of Higher Education to go to online learning for a lot of it. We also today, the Made in Montana trade show, which can have up to 5,000 visitors. We got rid of all outward-facing facets of that. So there certainly could be additional things happening and closures into the future.
What do you see your role in that? Is that those you've been sort of locally driven decisions at this point?
Yeah, I guess a couple of things along that. Potentially, I could have roles to direct closures. I mean, under the emergency order, the authorities are there. I think for individual event managers and people that are putting together events, they should be thinking about that. Also, for individuals deciding to go to large group events. But I think that even that, as we've seen in the last week, how dynamic and how evolving and rapidly changing this is, I mean, we're going to be assessing those things 24 hours a day.
Governor, you talk about events and that sort of thing. You mentioned how the university system is going online. Is there discussion about high schools and other schools? There are states, there are countries closing their schools. Is that something we're talking about?
Well, not as of today on Thursday. I mean, like recognizing also that, first of all, everybody in school should be taking precautions along the way. I mean, we know, first of all, the COVID-19, it's most dangerous to the elderly, those that have chronic health conditions, and others. And candidly, even as a parent who has kids, knowing that for sort of the school-based age populations, that it's often the flu that can actually be that much more dangerous. But no, it's a rapidly evolving situation. I mean, and what we're going to try to do, one of the reasons why we're doing this, is to provide as much transparency along the way to all of you as we can.
In regards to test kits, how many do we currently have?
So, and think about even last week where I said we had the capacity to test about 100 people. Right now we have the capacity to test over 1,000 people. There were 21 individuals tested today.
In Montana?
In Montana.
And, I mean, how and when do you guys see getting more?
It's a constant discussion of, making sure that we have the capacity and the needs that we have, or that we will need.
Is it like at the healthcare provider's discretion on who's tested, or is there state guidance on that?
Todd, go ahead.
Thanks, Governor Bullock.
Also, say your name and...
Oh, yeah. Hi, good afternoon. My name's Todd Harwell. I'm the administrator for the Public Health and Safety Division within the Department of Public Health and Human Services. So the question is what's the role of a physician or healthcare provider in testing? So we've gotten a number of questions from the public on that. And so if a person is concerned about their exposure to coronavirus, the way that they would get tested is they need to talk to their health professional, be evaluated for their symptoms and probably their travel history as well as other things. The physician or mid-level provider would determine if testing was warranted.
And call ahead.
Yes. Yeah.
In
This
regard,
is John Adams with the Montana Press. Can you hear me okay?
Yes, John.
On that note, one of the things that we saw happen with international travel is people who are coming from places where there were no infections, such as China, were getting tested. We have domestic flights all over the country into Montana cities where people are coming and going from places that have no infection. If somebody is traveling to or from, or is coming into the state from a place that has known infections, will they be getting tested, or do they have to develop symptoms before they're tested?
So, as but an example, if I understand your question correctly, so right now there are 5 states, Montana being one of them, where there haven't been any positive testing. So if someone's flying in from California, are they going to be immediately tested when they get here? Was that the question? Because there are, for the countries of concern, there are protocols for making sure that those individuals are either tested or quarantined, that it's not from if somebody's coming to Montana from another state.
Once those tests, Governor, are administered, how long then, I know we don't have to send them off to the CDC, they can be done here locally in the state now, but how long, how does that shrink the time frame? How quickly do we get results?
So we get results same day. Usually it's right near the end of the day. Like as I noted, we had 21 tests today at the state lab. Just found out moments before coming out here, all 21 were tested negative. To the extent that there's a positive test, we would release that right away.
Was just wondering if you saw President Trump's speech last night, if you had any thoughts in terms of what he was talking about in terms of dealing with the coronavirus, and if there's anything at all you'd like to see be moved through the Congress to deal with this issue?
Well, I think that, and look, I'm on weekly calls with all of the governors, the vice president, the leaders of most of the relevant health agencies. I think that this is a time where we all have to work together and be coordinated. And I think that as we look at, even during those calls, it mentioned things of family leave and others, areas where sick leave for a lot of the service industry that doesn't have it. But I haven't seen what's been kicked around DC today, but we'll weigh in and provide input.
Is there anything that you think the state can be doing when we're looking at school shutting down?
Hold on just one sec, ma'am. Sorry.
If we're looking at schools shutting down, parents that maybe can't take time off or to take care of their kids, or kids who get meals in school, are there things the state's looking at doing outside of federal actions that we might see be able to help, whether it's that or hourly workers who don't have them?
Yeah, and I mean, that's both what the task force is doing, what Department of Labor is doing, what we're all trying to, as we go forward, try to look at everything that the eventualities, but nothing concrete right now.
Does the executive order change anything for your ability to respond in any of those places? Or is it
The executive order respond in which sort of places?
like if you're looking at you getting meals to kids that would normally have breakfast at school or something like that?
At a broad level, like a state of emergency would allow me to impact regulatory laws. It also allows access up to $16 million of the emergency fund that I have.
In regards to large events,
We'll get you next, ma'am. Yes, go ahead.
Do you see the governor's office stepping in to maybe shut things down, like basketball tournaments, the Butte St. Patrick's Day Parade, stuff like that?
I think a lot of this right now is still with individual organizers of events to make sure that, that they turn around and say that they think that's in the best interest of the communities. But it's also, I mean, this is a dynamic situation. You had a question, someone on the phone. A woman.
Yeah, my question is about federal dollars $$1 million, is that right?
One more time, please.
My question was about federal dollars associated with declaring a state of emergency, but I think you already answered that.
So the dollars that I mentioned, the $16 million, are state dollars. There may be the potential down the road to get additional federal dollars as well.
Governor Bullock,
Okay.
as you said, the elderly are the most susceptible for this. Is there anything being done or looked at to protect those communities, retirement communities, elder homes?
Well, there have been some discussions about what more could be done at homes, nursing homes. Nothing to announce yet, or do you want to talk? Sure.
Thanks, Governor. Excuse me. That's all right. So yes, so a lot is happening now in terms of trying to protect vulnerable populations. I'll just give you one example. The department had a recent conference call with nursing homes across the state and hospitals, and there's discussions about in nursing homes and hospitals to protect their vulnerable populations are implementing visitation restrictions, screening workers to ensure that workers, healthcare professionals coming in aren't symptomatic so they don't transmit disease. So quite a bit is happening on that.
And you guys kind of touched on it a little earlier, but how are we determining who gets priority for testing?
It's the individual physician or doctor.
Is there any way to waive the fees or co-pays or costs that would require to get the testing, any doctor's appointment?
So I believe, and correct me if I'm wrong, that every insurer yesterday said that for the test, every Montana-based insurer are waiving the co-payments on those.
What about the uninsured?
Yeah, hasn't been directly addressed yet.
Do we know how many?
This is Aaron with Montana Public Radio. Do we know how many requests have come in for testing?
To date, 55 requests have come in for testing.
So 55 tests have occurred.
Correct.
Yeah.
Yeah, 55 tests.
55 tests have occurred, but do we know how many requests there have been?
That's one.
That's an
It's
individual
1-to-1.
doctor.
Yeah.
Right?
Yeah.
Yeah.
55 requests, 55 tests.
Yeah, so that there have been 55 requests from a physician to have a test conducted. Do I know if, like, individuals had called their physicians or practitioners? I don't. Was there, did we cut?
Governor, this is John Adams again. Am I good to go?
Sure, John.
Okay. Thank you. So I've been asking some questions about this. Back in 2005 and 2006, in the wake of 9/11, there was some federal funding available to all of the states to put together disaster planning. Specifically, there was a $723,000 that went to Montana to put together a pandemic flu response plan. So far, the information I've been able to find online is nowhere near as detailed as far as laying out specific planning as that draft 2005 plan. I'm curious, does a detailed plan identifying what all of the different roles of local and state officials are exist for review?
Yeah. So if I understood the question correctly, the answer would be yes. There's two levels of plans, and the Department of DES, or Department of Emergency Services, has statewide plans developed that cross all state agencies. And then for the Department of Public Health and Human Services, specifically for public health, we have a series of plans that we use and update regularly for to be prepared for these types of events.
And where can we locate those?
We can provide those to you.
And then, how big of a role do local county boards of public health play in this response that we have right now? And are all of those county boards fully appointed and staffed?
So the local health departments and tribal health departments are vital. They're our frontline partners, as well as hospitals and other organizations. But those folks are the boots on the ground that are actually working right now today with providers in their communities to evaluate individuals, to assess their risk for the virus. They also, we fund them, and they conduct a lot of work related to emergency preparedness. So they're like one of, at least for public health, one of our number one boots on the ground partners.
Does
In
the
it, the
state's
2005 plan,
Last question, John. Go ahead, one more, and then, go ahead, then there's a few other people in the room. Go ahead.
the 2005 plan laid out, okay, Okay, the 2005 plan laid out some numbers based on the CDC predictions for what could happen if a pandemic on the scale of the Spanish flu were to hit. And in Montana, it predicted 333,000 that would be clinically ill, 165,000 that would require outpatient care, 3,600 that would require hospitalization, and an estimated 850 deaths. Do we have updated numbers based on Montana's current population and whatever preparations we have in place to update those predicted numbers?
To date, we don't have like model predictions. Usually we work with the Centers for Disease Control on that. And because again, this situation's kind of evolving as we're going, we don't currently have that information.
Matt?
My question was about, they call it PPEs. What are the supplies like, and are there requests pending for more equipment with the federal government? Has there been any response to what the need is?
Sure. So PPE is personal protective equipment used by health professionals to prevent transmission of infectious diseases. Currently, supplies are limited across the United States. I'm sure you've seen the headlines related to that. Our hospitals are working with the Montana Hospital Association to do outreach to get more supplies. But it is a concern that we have currently, particularly for health professionals, to make sure that they and the patients are safe.
Has there been any talk about what capacity of hospitals being an issue in countries like Italy? What is capacity like in Montana's hospitals? Is that a discussion past versus now?
The discussion of the capacity of hospitals. Yeah, sure.
So our division, Public Health and Safety, working with the Montana Hospital Association, we have a data registry, and we work with the hospitals across the state to daily monitor bed capacity, ventilator capacity, so we're able to monitor that regularly. So we know currently how many available beds there are in the state.
How many are there?
I can only give you an example just for in one area because we hadn't broken it all down. But so an example for med-surg beds across hospitals, medical surgical beds across the hospitals in Montana, out of approximately 1,400 total beds, there's about 400 available.
Anything else?
Yeah, Governor, this is Tom Schultz from Northern Broadcasting System. I wanted to have one of you guys to explain the mechanisms that would be in place if someone were to test positive in Montana, such as quarantines or investigations.
Go ahead.
So if an individual tested positive here in Montana, we would know about that initially because of the physician who ordered the test, and the local health department would be involved with that, so we would know that, of that. Once a positive test occurred, the provider is notified so they can notify the patient. Then again, back to our local partners, local health departments, they would work with the provider to determine the appropriate course of action. It could be isolation or other measures, but it's really our local partners down in the field, local public health, who would work on that on a day-to-day basis.
Anything else? Well, thank you again, and we'll certainly keep all of you apprised as what is a dynamic and fast-changing situation as we learn additional information. Thanks so much.